Hello, I'm Dr. John Camacho and I come to you from Suncoast Chiropractic and Rehab. Today we're going to be touching on the subject of plantar fasciitis. A lot of our patients come in with debilitating plantar fasciitis pain that they've had for a while. Most of the times they've already gone to the podiatrist, and the podiatrist has done some treatment. Usually what they do is they do an injection on the plantar fasciitis, just try to get the inflammation down. But we're going to show you how we can help you get rid of this pain for good. Alrighty? So the first thing that I have to do when you come in is we have to basically analyze what's going on with your foot. A lot of the problems that happens with the plantar fascia is not originated in here. It's actually originated back here. We have what we call the calf muscles right in the posterior aspect of your foot, of your ankle. And then they join the back of your foot through a ligament that's called the Achilles tendon. So we got to make sure that that Achilles tendon is not completely taut. The other thing that we have to check is to see how much inflammation the patient has on there. We also have to do an x-rays. When we do x-rays on the foot, what we can find out is if there's any growth of bone on the bottom side. There's a lot of patients that come in here that have had this for many years, and it's a result of a bone spur. Bone spur is nothing else than the muscles pulling on the actual bone and causing type of a spike underneath the foot. So when you're walking essentially on a spike that's been, embedded in your foot. Over time, it causes a lot of inflammation. So what we do, the first thing we do after we check to see if there's any bone spurs on there, is we got to loosen up the muscles, right? You want to loosen up the muscles so that tension that they're causing on the Achilles tendon goes away. So we do that through just technique such as magnet therapy. We go at the foot. We basically analyze the bottom of the gastroc. Is that tender there? So when we look at the bottom of the gastroc, we can already find some areas in the muscle that are tense. The other muscles that we check are the peroneus muscles on the side, and we also check the tibialis anterior on the front. So this tibialis anterior is the muscle that allows you to do this, right? And this muscle and the muscles on the back basically need to be in balance. If they're not in balance, you're going to have different changes on your foot. Now, with this also comes the fact of you probably playing sports every weekend, or you're wearing heels for extended periods of time, which can also aggravate the situation back here. So the first thing is loosening up these muscles, and we will go at this for about 10 to 15 minutes just to make sure until all of the tension that you have in there, any trigger points in the muscles, they go out. I utilize this technique right here. This is basically a metal tool that I use on the tissue to go around the tissue and find where you have tissue adhesions on the surface of the muscle. If I find one, I'll go around it and try to break it down. Now, we can't just fix you on one time, unfortunately. So this is a therapy that has to be done for a couple weeks with some things that you're going to be doing at home. Now, step number 2 is we go after the actual fascia. Now, depending on the inflammation that you have on the foot, it may be really, really painful. So you always try to communicate with the patient just to make sure that the patient is not in extreme pain, because we don't need to fix the problem right away. Well, we have to put a lot of pressure. So based on what the patient can hold, we'll also get feedback from them. Is that okay? You can hold it? We go from the bottom of the foot, from the posterior side of the foot, all the way to where you feel the muscles and the bones on this side. And you continue to do that until you loosen up the muscle. So on here what you have is muscle, tendon, and then the sheath, a very thin sheath that goes around the muscle, which is actually called the fascia. Now that fascia has to be able to move, and if it doesn't move, when it breaks because of the tension that we spoke about, it creates inflammation on there, and that's what the plantar fasciitis is, inflammation of the fascia. So what we're going to do is we're basically just pushing out all the inflammation from here, softening up all the soft tissue, and after I've heated up the tissue around the area, then I go after it with the tool. Now this is one of the situations where the patient is probably going to be bother the most on the during the procedure. But it's something that just by asking the patient, is that okay?
Yeah.
Not too bad? And I always tell the patient to let me know if it's too much and we can back down. So just move around. So right now with the tool, with the metal tool, it really helps me finding out where you have adhesions on the tissue. Things that you wouldn't feel with just a straight thumb on it. All right, so after we do this, what we do is we turn on our machine, our ultrasound machine. And I found that this is one of the techniques that really helps me out with plantar fasciitis patients. So the machine's not on right now. I just want to show you what we do. The machine cannot be on, otherwise the crystals on it would break. But right now we go basically in circular motions around the area. So we usually stay here on the calcaneus muscle, and we move it around all the way to the front of the foot, right? We go back and forth in circular areas. And we do this for about 7 minutes, okay? Usually the patient will have this issue going on both feet, so we just do one at a time, okay? So the way the ultrasound works is basically it makes the cells vibrate on the inside and they create heat. And that's what's called endogenous heat, which is just heat coming from the foot out. So we go around with this. And every treatment we have to do these techniques in order to get you to heal faster. Now the last thing that we do is we have some vibratory machines I'll be showing you in a second, but what we do is we have the patient stretch on those vibratory machines. This accompanied with some home care that I recommend for the patient. One of them is the best treatment that you can find for the less price ever, which is you basically take a bottle of water and you freeze it. After freezing that bottle of water, both in the morning and the afternoon, you're going to put your foot right on that top of that bottle of water, and you're going to move it back and forth. That creates massage underneath the fascia, and it also creates, it provides ice for the area to lower the inflammation. Depending on how bad the plantar fasciitis is, this may take from 1 to 2 weeks in order to lower it, and it also depends on how long you've had it. But we've had really great success with our patients. If you're having a condition like these, please let us know. We can help you out. Just call the number below. Thank you. So after we finish doing all the soft tissue therapies on the calf and the bottom of the foot, then we go ahead and stretch it, right? Because we have to stretch those tissues. So usually when we have somebody stretching at home, we would basically have them put their hands against the wall and do a nice stretch of that calf right behind them. But here I like to utilize the neuromuscular re-education, because vibration actually releases and relaxes the muscle a lot easier than doing it by yourself. So what we have the patient do is safely climb on top of this machine, on the top of this contraption here, and then with the vibration he's able to put all his weight on the foot that's actually affected, therefore increasing the stretch that you can get in the muscle with very little pain. So we do this for about 2 to 3 minutes, and as the patient progresses we may do it longer, but this really helps the patient kind of like stretch and get all that inflammation out of the muscle. After we're done with that, we give the patient instructions on what to do every single day when they go home. Usually is the utilization of that bottle, that frozen bottle, to do massage and ice at home. And we do this for a period of 1 to 2 weeks, and usually with our patients we get great results. So if you have been suffering from plantar fasciitis and you've gotten injections, or if you've never tried anything, just come to us. I'm sure we can help you out.